fine. Why don't we teach this during the antenatal time?
We teach breastfeeding positions, we teach breastfeeding problems, all of these, they are done antenatal time. Even the examination to identify breast issues with the breast, the inverted nipple, big nipples and all that, they are done right at the antenatal. So your midwife knows that my client coming to deliver is a mother with one of these breastfeeding issues. So right from birth, and when you deliver, during the routine care and all that, we also take you through these things, breastfeeding issues. We support you with breastfeeding.
Okay.
Yeah. So talk to your healthcare personnel.
Good morning to you, Monica. Your question is very interesting. So Monica says that, and you can send yours in 05939329993, 05939329993. It's WhatsApp, so you can send a text or a voice note. So Monica is saying that one of her challenges when it came to breastfeeding, one of her challenges was that she couldn't tell when the baby was full. He says, can you ask MAVIS for me, is there any sign that will show that the baby is full? Because he said I had to estimate. So is there any sign? Because the baby is not an adult to say I'm full. Like, is there something that would tell you that this baby is full?
So actually, when your baby is full, they often release the breast. Yeah. They often release the breast. And sometimes, even when they are full, you try to put them to breast and they are not ready to. Yeah.
Okay.
So that's what happens. But make sure, we can also have lazy feeders. They are always sleeping. They have arrived in the country they want. So they are always sleeping. So make sure that you are at least following the times. We are doing breastfeeding on demand, right? But we have some of these babies. Every time this baby is asleep. So let's make sure we are following the times. We are saying that at least every 2 to 3 hours, you are breastfeeding your baby. You are putting your baby to breast.
At least every 2 to 3 hours.
2 to 3 hours.
Okay. So that's
and
a good thing.
You are not doing 5 minutes breastfeeding. You are touching your baby long enough. Sometimes your baby is like gassy. So let's make sure we are burping them in between feeds. You can burping say adult, when we eat and we are full, we are able to pass out gas through the mouth. But for the babies, you have to position the baby right upright, or sometimes on your lap, but make sure you are supporting the head.
Okay.
Then you tap the back gently. You can hear the sound.
You hear the sound.
Yeah, the gas comes out like air or something like that. Then you can reposition the baby to identify if my baby is full. If your baby is full, your baby is not going to accept the breast.
Samira wants me to find out from you that, is it normal for babies to vomit after breastfeeding?
It often happens with overfeeding. Overfeeding.
Okay.
And sometimes when you burp them, with the gas coming out, some of the residue can also come out.
Okay.
And the placement of the babies. Now we are promoting back to bed or back to sleep. And research is showing that it's kept, or it's cutting down sudden infant death. So how you place your baby after breastfeeding can also cause some of this. And the position. If you did not position your baby well, your baby was having tracts of air, fill while breastfeeding, your baby is going to vomit. Because the air is going to compete with the milk for space.
Okay.
So as the gas is trying to come out, it will come out with some of the milk forcefully.
Okay.
Because it is gas. So that's it with vomiting. But once your baby is vomiting, make sure your baby is not lying prone.
It's not lying on their back.
Yeah, it's not lying on their back.
Okay.
Pick your baby up, support the head,
Mm-hmm.
and make sure your baby is breathing well.
Mm.
If your baby is vomiting through the nose,
Mm-hmm.
if you have a healthcare provider around, or now we have platforms, and they even have our contacts that they can ask questions. Make sure you talk to somebody. Don't let your baby will aspirate and cause other issues, pneumonia and all that. So position your baby well. Your baby should not be vomiting after every feed. Even with the burping, with something small coming, it's a spit up. It's not that vomiting. We know vomiting. Yeah, so once you are seeing the L, my dear, check your position well. Take your baby to the hospital for assessment.
Good morning to you, Tony. So, okay, Tony's question is really, really interesting. Okay, so Tony is saying that my wife and I noticed that our baby prefers to feed at night rather than during the day. Ask your guest if this is normal. A night feeder.
Well,
the baby prefers to be breastfed at night.
Only at night.
Only at night.
Hey, then we will not get her 8 to 12 times. So
but does that happen?
Yeah, babies feed at night. I said your baby is feeding within the 24 hours. You know, within the day, 6 to 6, it's like 12 hours. So if we are saying 24 hours, then your baby feeds at night as well. And we know the night feeding also helps support lactation amenorrhea method for family planning. So it's good that your baby is feeding at night, but it shouldn't be only at night.
Okay.
Your baby should be feeding in the day too. So in the day, what are you doing as a mother? Are you having other activities and not having enough time for your baby? So that in the night, it's sort of in the night, I have my mom all to myself and I can breastfeed as long as I want. So check the activities you are doing in the day. You know, our elders or, let me say our elders were not unwise, saying that once you deliver, you stay at home. In fact, sometimes you might not even be allowed to, you might not even allowed out of your door unless you are going to bath. So those were all the mechanisms they put in place to ensure that your baby is adequately fed. We did not understand. We thought that you are staying inside to look good for them to say that, yeah, your husband took care of you. But these were some of the reasons they could not explain. So make sure you are with your baby. You have time for the baby. You have time, 2 hours, 3 hours. You are putting your baby to breast. And if your baby is also feeding well, we've said you can identify from the diapers, the number of wet diapers your baby is having in the day. Is your baby having 6 to 8 wet diapers in the day? Your baby is feeding. Is your baby gaining weight? Your baby is feeding well. But I'm not sure we can have, the baby has to be helped in the day. So the mother should check what she is doing in the day. Let's say have more time for the baby.
Good morning to you, Sewa. Sewa is sending a message, and she's saying that yes, I can attest to the fact that breastfeeding is one of the best things to happen to a woman who has a child. She's saying that she can attest to the benefits of breastfeeding. She has breastfed all her children. She breastfeeds all her children. And I can tell you that even though it is very difficult, and sometimes you are tempted to stop. But it is good to breastfeed your children. It has a lot of benefits, and I see it in my children. Yeah. Yeah. So she's saying that she has breastfed, and it can be challenging.
Yeah.
It can be challenging. She sent an earlier question before this, and she was saying that we should talk to the mothers about what they are eating, and that what they are eating comes out in the breast milk.
So we have those. I will use myself as an example. Whenever I took a palm nut soup, I realized I realized my baby was pooping more and with that same color. Yeah. Some mothers have also complained. I remember, I think was it Dr. Ashura or one of my colleagues was talking about also mangoes. Once she takes mangoes, she realized that the baby was pooping more, and in that
mango cat. So you have to be careful about what you're eating.
Yeah. So you have to be monitoring your baby. You know, our mothers, they are the best nurses. So yes,
Some.
In fact, they know their babies.
Some.
They know their babies, and what you are also eating can also help. Because we have research pointing to some food. Example, the nuts you were talking about. Some also says dehu, TZ.
Is that why I see a lot of breastfeeding mothers eating TZ?
Yeah. So
okay.
all these meals, they help.
Okay.
But keep yourself hydrated and get a well-balanced diet.
Yeah.
Get a well-balanced diet. Keep yourself hydrated, and you are good to go. With demand and supply, because you know sometimes some of these mothers, some don't even have quote and unquote that money to feed themselves well, but still they are breastfeeding. They are breastfeeding, and their babies are in the range, the normal range. Yeah. So it has to do with demand and supply, yes. But as a mother, you also have to eat well.
You have to eat well.
You have to eat
and
well.
You have to be conscious of what you are eating.
Yeah, be conscious of what you are eating.
Don't go and eat some very spicy soup.
And even some drugs. Yeah, some drugs as well. So as a breastfeeding mother, whatever you are taking into your system, make sure you are communicating with your healthcare personnel. No over-the-counter medications, no alcohol. Because I know mothers, they take alcohol. They do, yes.
Wow.
So in the communities, they want to take alcohol to eat better. They say when you take alcohol, you eat better. So they say that, when you delivered, your husband took very good care of you. You've increased in weight and all that. So they often take alcohol. But
alcohol?
Yes, alcohol. The local ones.
Wow.
Yes.
And the baby would take some.
Yeah.
It will pass to the breast milk.
Yeah, it will be excreted to the breast milk. We know our babies' liver are also not well matured. Yeah, so let's not take alcohol. Let's not go there. Whatever we are taking, drugs, anything, speak to your healthcare provider when you go for your regular visits, your postnatal visits and all that. Any problem you are having, positioning, attachment, all that. Because
your baby is very likely to also take some of what you are taking in as part of the breast milk.
Of course, and yes, you could have some kind of conditions. Once you are taking alcohol, even in pregnancy, you could have fetal alcohol syndrome and all that. So we should and we can't quantify the amount of alcohol that can lead to these kind of conditions. And the drugs, we can also have neonatal abstinence syndrome and all that, tramol, all these drugs. So let's stop them. Let's take the prescription, doctor's prescription.
So what your health worker has prescribed for you is what you should take. You should take. No over-the-counter drugs. Don't try and also self-medicate. I find quite a lot of mothers, and like for those of us who are who are on radio and people know us a bit, ever so often you will get somebody sending you a message that I want to take I want to take this drug that I have seen somewhere, and is it good? I'm always like, I mean, this is a very strange question you're asking me.
Do you know, mostly when a mother delivers, we give the antibiotics for sort of, I think it's for 5 to 7 days. And the mothers think that the wound, let me go local. They think that so once they are done, they will come to the hospital, regular visit. Madam, my medication is finished.
It's my baby's also.
But we want you to know that what you need is what we have provided. After the 7 days, all you need is your balanced diet, your adequate hydration, your rest and sleep. Don't stress yourself. Don't stress yourself.
Don't stress yourself.
Don't stress yourself. Don't stress yourself.
I think that when and I think you mentioned something that husbands, my gender, we have to be supportive.
Of course.
Because sometimes, it's not sometimes, the mothers are tired. They need to rest. They need to do other things. Sometimes they have other small errands that even though you tell them to stop, they still want to do it, because that by nature women are stubborn. You have to pitch in to help. I mean, you may be busy and all, but when you are available, you have to pitch in to help, so that, like Mavis said in the beginning, even if the breast milk is bottled or is expressed and is kept, you can be doing the cup feeding whilst the mother is sleeping or doing something else, and that balance alone helps with a very sound-minded breastfeeding mother, because if she has a sound mind and she knows that you are supportive, there's a high probability that she can sleep well, she's less stressed, and then, there's going to be more breast milk production. So let me open the phone lines now. I want to hear from you. If you're listening to us and you have experience in breastfeeding, or you have a question to ask about breastfeeding, you can call us now. The number to call is 0541 022 318 0541 022 318. You call us 0541 022 318, and let's hear from you about your breastfeeding journey, your breastfeeding experience, or the questions that you want to ask us this morning about breast milk and breastfeeding. 0541 022 318. And yes, the Mavis is here. She's going to answer all your questions. So you can also send your questions in as well. But you can call us on 0541 022 318. Maybe someone wants to find out from you. She said you talked about supplements and why people should stay away from all those supplements and things, but she's still curious about the fact that somebody's calling. Let me pick this call and then I'll finish with her question. Kindly call back. Please do call back. 0541 022 318 0541 022 318. So she was saying that there are certain drugs that we prescribe in hospital that they say improve breast milk production, and she wants to know whether it's true or it's false.
Yeah, it's true. So we have mothers with some conditions.
Peculiar challenges.
Challenge, but that's not for everybody. And even with that, they have to they have to take the comprehensive history, examination, investigation, and all that to arrive at that. We don't just prescribe the drugs. So yes, there are medications, but that medication is not for everybody.
It's not for everybody.
Once you are well, you should be producing enough breast milk for your baby. You should be producing enough breast milk for your baby.
All right. Hello, good morning.
Good morning.
Yes, your name and where you're calling from, please.
My name is Monica. I'm calling from Texas.
Okay, kindly go ahead, please.
I want to ask you, can you feed it to the baby?
Your line is breaking. Can you reposition and ask the question again?
Pardon?
Can you ask the question again? Your line was unclear.
Okay, I said that.
Yes, hello, we can hear you. Hello. Oh, the line is so bad. Hello. Kindly call back. The line is so patchy. We can't hear anything at all. 0541 022 318 0541 022 318. So you're saying that there are some people who, because of certain conditions, they are given medications to breastfeed. Okay, let me pick this call. Hello, good morning.
Good morning. I'm Patrick from Papa Kente.
Yeah, Papa Kente, thank you for joining us. Oh, yeah.
Nyadmo Patrick Namunsoe.
Yeah, oh, yeah, pa. Patrick Manenko.
Patrick no pay the metia, Madam Yawotu. In fact, Wabe pa, Osia Danasi no pay. Now, Patrick, because a bebena, it me chakranufo. Maybe a crano, time bena, a drua, a was a teacher no for money, and near one. And I Patrick, the Tossum, you know, because on the young girls ni go on ma go bi o school no wawo na ediane ba no fi na omode sam nuane bi hospital nuane bi ne sa ne man mbuda se omudi na no ne best difference nim na difference wo mu so I want to say Pastor Medase.
All right, Papa Kente, Mr. Dase, thank you. So when do you stop breastfeeding?
So ideally we are supposed to stop breastfeeding by age 2.
Okay.
So when your baby is 2 years, that's when you wean your baby off.
Okay, you hold on. Let me pick this call from Obapa, and then you can box that one in. Hello, Obapa. Good morning.
Good morning, Dr. Jima.
Yeah. Pacho Mahoye now, so.
Oh, Mr. Mahoye.
Great, Obapa Manen.
Damasi. Ninchile pa. Mo chile. Yusia pa nyanko ponshiramu.
I mean shout.
Ampacho. Minu ya bane katano. Okase mano omuwo omuni diye. Na me busane se obehu oba bi wawo. Ya yefufu ayuwa ma anabomma yesinanim. E de nkwan so atato wa de asinchen. So di anu wasagum. Na ne maame te ho. Didi dinintem ma wonya ha mene na ye kama na no na me busa doctor say eno no eyese sa wo ba no de aduane sa sinanim di na me kwahye to so mienu so e say young girls na aba na wo ma wo no bonso wa wo ono wo hyedem ho a TV na no wo hwe tese wonna enye na home emma no funsuo no mflo so nti die no wo ka kire sa ma no oba eman dodo na oba wo a tese ewia wonna da TV ni phone TikTok obehwe saa na ne bani sunsun no atam na ato ne na no so a eno so ohwe ne bana nimo TV na TikTok na ne bana nkasa na e fight no fo no obabi wo so abawu ne no fo no so muodu wait wom no ajani nyina ma baby no na baby no nko a sakesa anti dia no waka kire ma no guess na ba no ye de ya wawie ɛna nkyerɛkyerɛ we so yɛ continental ya tie ni nyina de ayɛ adwuma nti on kanche youth no no muntie na momfa mu aba nyankopɔn hyira mo no hyira Orange FM we do bi ase. Bye bye.
Bye. Oba Panyamin Shawn. So let's just answer with let's continue with Kente. So 2 years.
Yeah, 2 years. But at 6 months, you are supposed to stop. You are supposed to stop exclusive breastfeeding, not breastfeeding.
Okay.
Yeah. So at 6 months, you introduce feeds. The local ones we have and all that. So at 6 months, you can introduce these feeds. When you visit your child welfare clinic, they will take you through all these. The food you can take your baby, you can introduce to your baby, how regular and all that. Yeah. So by age 2, you have to. Yeah. You have to stop.
By age 2, you should have stopped breastfeeding.
Yeah, you should have stopped breastfeeding.
Okay, but from 0 to 6 months, so we're doing the exclusive. So after the 6 months, like Papa Kente was saying, sometimes you have, like the mother is not there, so we would introduce some foods. Is that the most ideal thing to do?
So
hold that thought. Let me pick this call and then we continue. Hello, good morning.
Hello, morning.
Yes.
Pacho
Mhoye. Pacho first.
Yeah. Pacho de Rashida.
Rashida and Pacho. Bit me bisa question.
Pacho, the question is, if 2 years my with major breastfeeding now, how many days and a month in the big dance and a breast milk on the
Okay. All right. That's Rashida. All right. So 0541022318. So still on the breastfeeding. So after 2 years, will the breast milk stop?
So let me begin with Papa Kente's question. Yeah. So at 6 months, we introduce feeds. And he was saying that some of these babies, due to the mother's work, they are given extra some formula feeds and are they good over. So I said earlier that the formula feeds, we can say that they are providing nutrition, but they are not providing the required nutrition. Now, we have companies making human beings, let me say, AI human beings, but you will know that it is not the natural state.
Yeah.
So breast milk has these living cells, stem cells for brain development, and it is in its bare state. It is what the baby needs, what the baby can digest in the required proportion. Formula feeds can try, but they will never get to this.
The breast.
They cannot. It is natural. It has carbohydrates, fats, everything, micronutrients, vitamin A, D, E, K, vitamin C, all that. It's not all these that you can find in the formula. It also has stem cells. It has omega-3 for brain development. You cannot find these. And even with the formula feeds, research is showing that it increases our risk for obesity, type 2 diabetes. Breastfeeding, research is showing that when you breastfeed long enough, you reduce your risk for ovarian and breast cancer. In Ghana now, wherever you turn your head, people are getting breast cancer.
Yeah, that's true.
So once breast milk is going to lower all these rates, so you cannot compare formula to breast. We can have some let's say some cases, not some rare cases like the mother is not there. The mother died at birth. So with that, in Ghana, it's now that we've started this breast milk banking. But we cannot get breast milk for the baby at the moment. So we might have to use formula feeds. But you cannot compare formula feeds to breast. aside all the things we know previously that it promotes bonding, you don't need money to buy it and all that, we have other things now. You have our mothers complaining that, yeah, you are saying all these, but didn't I give you porridge and all that in childhood? But we can attest to the fact that now there's a surge of conditions. The cancers, obesity, diabetes and all that. And research is telling us that with breastfeeding, we are lowering these risks. So which one would you rather opt for? I would opt for breastfeeding. Yes. And also, other mommy was saying that the food. You remember I said balanced diet. So my dear, don't be eating all the fufu with the minutest piece of meat and the little soup. Get the right proportions. In as much as we need you to eat well, we don't need you to be overeating or getting in excess one of the nutrients.
So, like she's saying, it's not the fault of the new mother. It is the supposed experienced mother who is saying that I was so didi. You have to eat, and like she's saying, you have to eat fast. I don't know where that one came from.
I get it. So, now at the hospital, when you come to deliver at discharge, these are some of the educations we give to the mother, and we give this education to both the mother and the caregiver. Because we realize that some of these practices, example, called care, with the cultural things, cow dung and all that, the mother might not be doing it, but let's say the in-law or the mother at home, they often do perform these practices. So we add them to the education. In fact, they are with us, they are clients. So all this education we give to them. And the maternal child and health record book has these meals that you can eat. The 4-star diet, the nuts and all that. So they are all there. If you are finding difficulty, just open to the page, you read about it. If you can't read, the pictures are there. So you know the kind of food that you can be giving to your pregnant woman or your nursing mother. So it's not all about the fufu. What of the other countries who don't eat fufu? Even in Ghana, we have people who don't eat fufu. Yeah. And even with this feeding that you are saying, overfeeding, I also encounter mothers who don't want to gain weight, so they don't eat. Yes.
Whilst they are breastfeeding?
I bet you, even in pregnancy.
Really?
They don't want to gain excess weight.
Oh, but
the first year of a baby's life, as a nurse, I say is dependent on you, the mother, right from pregnancy to the first year, because the baby is not eating much. At the developmental stage or the fetal stage, it also has to do with genetics and some drugs or some of the things you, the mother, you are doing. By the time in Ghana we realize that we are pregnant, the baby had the fetus or the embryo has already been formed. The vital organs, example the heart and all that, by week 3 they are already forming. So right from now, in your daily life, you should be doing the right things, eating well, taking folic acid and all that. You shouldn't get to the stage where I'm pregnant, early pregnancy, my midwife will not do anything for me, so I'll go when the pregnancy advances. All these we should stop. Let's go to the hospital early. Good practices, eat well in pregnancy, or even when you are not pregnant.
Just eat well.
Eat well. Balanced diet. If you happen to be pregnant, you get your maternal child and health record book. The meals you can take, the ingredients, they are also there.
They are written in the book.
They are written in the book. The pictures are there. If you are saying you can't read, they are all there. Yes. And to the
and then she also talked about the distraction with social media when you're a young mother and they don't pay attention to their kids.
So right from the beginning, I said that once you invest in breastfeeding, you are investing in the future of your kid.
Yeah.
We all want the best. We want to see our children become doctors. We want to see our children become lawyers, nurses, and all that. It starts right from you, the mother. Once you are given breast milk, research is showing that it helps with cognitive functions.
Okay.
So if you are supposed to breastfeed and you are on the net doing what not, remember you are the one delaying or aborting your baby's let me say high IQs, because research shows that breastfed babies have high IQs.
Yeah.
So all the first year of a baby's life, mommy, it's for you. Sacrifice everything for your baby. Within that first year, you should be breastfeeding well. You yourself, you should be taking care of yourself well for your baby, because your baby will need you within the first year. And I know young girls, mostly what they think about is the sagging breast. Yes, that's the issue. Seriously, that's what I've realized. It is the sagging breast. But we should know that the breast, it has to do with the pregnancy. It has no your genetics and all that. It has nothing to do with breastfeeding. Your breast will sag because you are developing. I cannot say that my breast is same as when I was 16 or 18. I'm aging, so your breast will also age, whether you are breastfeeding or not. It is genetics. It's physiological. That's how it is.
That's how it
yes.
No matter what you do, that's how it's gonna go.
Unless you want to go for surgeries and all that, it will get to a time that your breast will not be how it's supposed to be. Even those who are not breastfeeding, it gets to your time. Your breast is not how you started your breast development with. So it has nothing to do with breastfeeding. It's pregnancy, genetics, physiology.
People don't want to breastfeed because they think their breast will sag.
They think their breast will sag. So that's about it. It's not about breastfeeding.
Okay. And I think Rashida was the one who asked, will the breast milk stop?
So I talked about breast milk being demand and supply. So once you are given, it is coming. Once you are given, it is coming. When you stop, the hormones also stop producing, and breast milk production also stops.
Okay.
So it's, I know when we want to stop breastfeeding, we use all the techniques. But you can have a baby removing your plaster and latching on.
Yes.
But once you stop, it will stop. It should stop.
And even once if you are, I think what most families, I don't say women, most families should be doing is, once you are moving from exclusive breastfeeding to introducing complementary feeds, you should talk to your pediatric nurse about it. You should talk to your obstetrician, talk to your midwife about it, so that, once the demand is going down, naturally the production is also going down. So by the second year, you would have probably completely stopped producing.
That one is just for pacifying them.
But we have some babies that even after 2 years, they want to breastfeed.
Yeah, it happens. Everybody likes sweet things. Yeah, of course. She's getting milk. Milk is nice. So they
but 2 years, dear. So
after 2 years, the milk, the components are not enough. For the baby. So the baby has to be weaned and take feeds fully. But even after the 6 months, after the exclusive breastfeeding, I know mothers can attest to the fact that you realize that your supply is not like when you just delivered within the first 6 months, when the milk was just coming and it will just soil your shirts and all that. You will know that after 6 months, after you've introduced the feeds, because your feeding times are reducing, you realize that the supply is also reducing, the production. It's also reducing.
Someone wants me to find out from you whether it is true that boys feed more than girls. The boy child is not spared.
I think with that, Ghana, we have to organize our own research because that's what our mothers are saying, that the boys feed more. Let me use myself as an example. Did my baby boy feed better than the girl? I would say yes, but I don't have any data to back that. Yes. I don't have any data to back that, so maybe one of these upcoming years we also do that research.
Okay, and find out if
the boy feeds
more. So to the guy who sent me the message, because he's saying that he's now fighting with his son.
Please don't fight with your son.
But maybe the son is more than 2. After 2 years, dear Jamami.
Oh, if the son is more than 2, then that should be weaning the baby. If you are finding difficulty, I always say, talk to your healthcare professional, because we are there for you, mothers. We are there for you, rain or shine. Sometimes you are sleeping and they are calling. We are there for you, but do call in the day.
In the day, don't call in the night.
Call in the day.
In the night.
Yeah, we are there. If you are finding any difficulties, you can come. The pediatricians, the nurses, the midwives, everybody is available for you. We are there for you.
In the night, you never know. Maybe she's trying to make another
Not
baby.
at all.
Does breast, we hear that breastfeeding provides some protection against pregnancy.
Yeah.
So it's a family planning tool, isn't it?
Yeah, family planning method. I even mentioned it earlier. So we have the lactation amenorrhea method. So with that, within the first 6 months, because you are breastfeeding your baby, you have to breastfeed your baby day and night adequately if you want this method to work for you, because we have mothers. They'll come and say, oh, I was doing this exclusive, feeding my baby. But madam, see, it's 3 months. I'm already pregnant, and they are crying. So you have to be putting your baby to breast.
Day and night.
Day and night.
I think when you are doing it at night, it also distracts you and takes your mind off reproduction duties.
You don't know people. We have the sideline position. She can breastfeed and still do whatever she wants to do. So, in fact, lactation amenorrhea method is there, but you have to make sure you are breastfeeding your baby adequately day and night. Day and night.
It's day and night.
Day and night.
Okay.
And not 3 minutes breastfeeding. Long enough.
Okay.
Yes.
Okay. All right. So, that is, those are the benefits of breastfeeding. It's an important part of your child's upbringing, your child's bonding with you, protection for your child against medical conditions, even in the future. So breast is best, and I think this year we have done a lot when it comes to breastfeeding. I think that the system has done a lot when it comes to encouraging people to breastfeed, and now many hospitals have breastfeeding corners. Now, yes. I can proudly say, I have some.
Hey, congrats!
we have breastfeeding corners, and so people, schools, organizations have a breastfeeding corner, so that if the mother has to bring the child to work, at least she has a safe space where she can expose herself appropriately to breastfeed. Because usually the challenge is people are shy to expose themselves to breastfeed. It's very difficult though. It's very difficult. People will not look away. People will not look away. They want to see something.
Hey.
So you are breastfeeding and everybody's watching you. It's a challenge for a lot of women when they have to breastfeed in public spaces. So let's create a very conducive space for women to breastfeed. I think someone sent a message there. It escaped me. She said the difficulty with breastfeeding. Say she has attempted to breastfeed her child at church, and the difficulty with breastfeeding is that everybody who has had a baby before is going to coach you on a different technique to breastfeed. Ubia person can be. Meanwhile, probably you are practicing an attachment method that is comfortable for you.
Yes.
So she says for her that is the limitation when it comes to breastfeeding, because she's uncomfortable with breastfeeding publicly. Because maybe you're holding the child in a particular way that you know works for you, but somebody comes and say, hey, no, we don't do it like that, you know, and they'll start trying to advise you and it doesn't work. Yeah, so that makes it difficult.
Yeah, and you know, the success of breastfeeding also starts right from birth. As healthcare professionals, we have to initiate breastfeeding within the first hour. Yeah, we have to. It helps. The breastfeeding story becomes a success. With the fact that people will watch. If you were to watch, and I would reduce all these risks, I think I will go for the reduction in risks. And also with the watching, there are some clothing that supports these issues. Example, you know, with our mothers, you have to lift your attire. But I remember when I delivered, I made sure that most of my dresses had buttons at the front.
Okay.
And they also have maternity bra. Maternity bra is here. Okay. So it covers like the top. It only exposes the areola. Okay. So you could even cover part of it with your handkerchief or anything. Then you position your baby well. But some of the babies, I remember one time in church, I was trying to breastfeed my baby, covering this girl with handkerchief, and this girl just removed the handkerchief. But it's there. But I know some churches have the breastfeeding corner or mothers in. Okay. So you find mostly mothers there. So let's be creating these safe spaces for our mothers so that they are confident enough. Because we have said earlier that once you are breastfeeding, you are investing into the future. In the future, these babies are going to be our presidents, our ministers, doctors, nurses, lawyers, and all that. We don't want to have set of children that we cannot name in the future. So let's breastfeed our babies.
All right. So on that note, let's breastfeed our babies. And MAVIS is also so what are you in this GDNA and what is it?
Oh, so GDNA is it's an acronym for Ghana Diaspora Nursing Alliance. Or you can see on my T-shirts. Ghana Diaspora Nursing Alliance, and we foster sustainable local and global collaboration between Ghanaian nurses and the nurses in the diaspora. You know, we have nurses with the surge of travel, migration.
A lot of your people have ended up elsewhere.
Oh, but we want the people in Ghana to receive that same care that's the people outside, the patients outside the country are also receiving what we call the standard care, the evidence-based care. We also want our nurses here to be equipped with the required knowledge and skills. So that's about us. We organize workshops and all that. It's a large group. Our leader is a professor. Yeah. At Johns Hopkins. Yeah, so we encourage all the healthcare professionals, especially nurses. But you know, the others, you can join us, associates.
But you have put nurses in the
group, so it doesn't matter. We have put there, but the doctors are marrying nurses, so you can still associate with us.
We have stopped marrying nurses.
Don't worry, you can still associate with us.
Okay, so it's a group to help in knowledge and skill transfer.
Yes. Okay. And also we organize conferences. I said we have workshops, training, and all that. So we have a conference coming up. In January 4th to 6th.
Oh, next year?
Yes.
Oh, okay.
At Kempiski.
Hey.
So, yeah, we are inviting Orange FM. We are inviting everybody to be there.
Okay.
So you can follow us on all social media platforms. We are
Okay.
on Facebook, GDNA, LinkedIn.
GDNA. Okay. Is it free to join or you pay dues?
Free to join. You don't pay any dues.
For now.
You don't pay any dues. It's free to join.
Okay.
Free.
It's free to join.
Yeah, free to join.
Okay. And the conference at Kempinski is also free.
Oh, the conference you'll be required to pay, which will be communicated.
But it's free to join.
It's free, and they are really training the nurses. I remember in June, they trained us on peri-health.
Okay.
You know, in Ghana, we are supposed to assess the woman after delivery, their perineum and all that. Sometimes we forget, or even the techniques. You've left school for some years. Even your suturing techniques you might have forgotten.
Yeah.
So we organize these workshops. We also had one training on Mama CVD.
Okay.
That's a midwife assisted monitoring on cardiovascular diseases. We've realized that Ghana, we don't have data on cardiomyopathy, and it's also killing our women. Yeah. So we trained the midwives on how to use a probe, a POCUS, point of care ultrasound, to take scans of the heart.
Okay.
Echo sort of, so that we can liaise with doctors in tertiary institutions. And
that's a good thing.
Yeah.
So GDNA,
Ghanaian Diaspora
Nurses Alliance.
Yeah. We are all over the world. Some are in the Saudi, Kenya. It's not only
the nurses are everywhere. Some are even in Togo.
Yeah, we started with Ghana, but now we've realized that some countries also like the idea. Yeah.
Okay. I mean, I think it's a good thing.
Yeah.
So you are there what in Kumasi?
So not in Kumasi. So we have directories.
Okay.
So I'm under the Women's Health and Midwifery Directorate.
Okay.
And it's there that I'm the maternal and newborn co-lead.
Maternal and newborn co-lead.
Okay. So you'll be seeing me often on conditions concerning our pregnant women, nursing mothers, and babies.
I see. Ghana Diaspora Nurses Alliance. Okay. Yeah. Very, very good.
We are inviting you. The conference, Kempinski.
Oh, may I come with a fee?
Don't worry, come.
May I come with a fee? Once you pay for my flights to Accra and back and get me a very nice room in Kempinski with a very nice 3-course meal. You know, I travel with my producer.
Oh, okay. Don't worry.
We shouldn't worry. We are not worried. We are not worried. So once you can take over, we'll come and cover your conference very well for you. No questions asked. But before we go, any final words on breastfeeding so that we can run out of the studio on a Saturday?
Okay. So I would like to say, right from the beginning, I've said that let's invest in breastfeeding. Let's invest in the future of our babies. With breastfeeding, we are lowering the risk for all the conditions that we are afraid of. The surge of cancers, ovarian and breast cancer. In our babies, we are lowering the risk of type 2 diabetes, obesity, and breast milk has the required nutrition in the required amount for our newborns. So let's just breastfeed our babies. Thank you.
Let's just breastfeed our babies. Any good mornings? Hello, hey, shout out.
Yeah, I want to say a very good morning to my family, especially Naomi Kokro. Please, I am Mavis Kokro. I beg you. Yeah, to my family, to my husband. I know you are watching me. Also, to my group, maternal and newborn subcommittee of the GDNA, my co-lead Winifred, my directors and Bonti and Miss Saada, international midwife, and also our founder, Miss Yvonne Commodore. We are happy you created this for us.
All right.
To my co-neonatal nurses from the Ghana College of Nurses and Midwives, I'm glad to be part of you. My mentors, Dr. Ashura, Dr. Nana, Dr. Adoma, my mess soup, Dr. P, everybody. In fact, if I didn't mention your name, it's because I'm overly excited. So thank you all.
All right. Thank you, Mavis, and we're grateful. And that brings us to the end of another exciting show this Saturday. We've been talking about breastfeeding and its benefits. We've been busting myths about breastfeeding and been showing you all the tricks about how to make sure that you are effectively and efficiently breastfeeding your child. I'm back on your radio next week Saturday from 8 a.m. to 10 a.m. My name is Dr. Jima, show ably produced by Alyssa. We're back on your radio next week Saturday. Enjoy the Saturday. Stay safe. Bye.